Hi, my name is Fred. I've just finished my CFR program, and when I first came here, I had a pinched nerve, one of many things, but the pinched nerve, I couldn't walk. I just could not walk. Um, I went through a 3 day seminar with it, and by the time the 3 days were up, I was walking perfectly. Uh, Pinched nerves hurt, and the pain is gone. It has never come back. So I continued with the program with Melissa for, well, it's been like 4 or 5 weeks now since then. And I went to having really bad pains in my knees, which are gone. I have a terrible case of neuropathy, and that's getting better because Melissa has taught me that in order for you to take care of your body, you have to start thinking about what your body needs. What your body needs, how you need to go about doing it, making things work evenly and in progress. I just am thrilled that I came here. I was very fortunate to have someone that known her and started me on this program. And I'm working on my weight loss, and everything seems, it's helping the neuropathy, everything seems to be going great. I am a very happy person right now. I'm 72 years old and I'm going to live to be 92.
I'm Jim Salas, owner of Acme Valley Key Service. I had 4 epidurals. I had PT, and the next course of my pain doctor says, well, the only alternative is surgery. When I first came here, I couldn't walk up steps, I couldn't walk down steps, and I couldn't stand on my 4-foot ladder, which I work on top of doors. I'm back to doing everything. There is no more pain in my L45S1, and I cannot expound, I cannot say how much better I feel in a short period of time. I'm infatuated, I'm excited, there's not enough to say, but I'm cured. It's just unbelievable. It was a great experience, it's well worth it.
Hi, my name is Magda Goreka. I'm a physical therapist working with children in the Bay Area. And after our 3-day workshop with CFR, I feel like I can be close to being a child again. Having fun, feeling my body moving in all new areas that sometimes became forgotten, and feel happy, light. Well, I had a very nice change working with one of the lessons when we were able to differentiate our fingers and work with the shoulder mobility, which changed completely my shoulder girdle and how much freedom there was. And surprisingly, on top of that, there were some changes that actually happened within my upper jaw and my palate. I don't know, it just changed. I don't know, it just wants to smile. It just spread out and became bigger and softer, and I don't know, some things are just surprising. Our body takes it in and brings you all the goodies you need.
Hi, my name is Kim Blue Falvey. I'm a physical therapist working in Grass Valley, California in a private practice. I was intrigued by the science. I loved the science, because what I learned is that I came back into my own body. I just got out of my head. I got out of my head and into my body, and I know that when I experience the real integration of what I'm teaching and what I'm doing and what I'm knowing, I can share it with my patients, and I just feel like within my own body I learned that I can move in ways I didn't think I could move anymore, and it came very quickly and it came very easily, and I feel like I learned how to own that movement, and I'm excited about learning more about that and being able to share it with people. to have the experience of finding movement and performing movement and inhabiting my cells and my muscles and moving my skeleton in a way that feels comfortable and rich and full. It's pretty awesome. Possibilities are absolutely endless. To find hope and confidence. I think CFR is a way to integrate some of the really linear stuff we do with people and to integrate it into their bodies, to give people an avenue to own the movement that we're trying to help them find, for them to find it and own it and be able to take it out and be functional with it.
My name is Menandro. I'm a physical therapist. I work for Alta Bates Summit Medical Center. In all honesty, I wasn't sure what to expect, and in fact, I was a little hesitant. Well, it's a class, so I can earn some CEUs. And we worked on restrictions, but it was more than that. It's just beyond the physical restriction. There is something underneath that gives you that physical restriction. Again, part of the value that I receive from it is to not try and control everything. I think now I'm a little more sensitive to the sense that I should not try to guide my kids all the time. I should let them explore. I should let them be who they are, instead of trying to create an image of who I think who they should be. To do, we try and control what we feel the patient should be doing. We know you shouldn't bend this way, you shouldn't bend that way, and CFR then allows you to see that no, you should not be controlling it. You can facilitate it, and I don't even want to use the word guide it. You should just let it happen and then allow the patient to realize what is happening. The only thing I can say is when you first entered PT school and you were looking forward to something that was unique, that you've never been experienced, that you've never had before, and that you are planning, okay, this is going to be my career. Consider the first day in PT school, I think, and that might help you with your journey. Feel lighter, feel freer, and again, there's this a sentiment that was expressed throughout the class: permission. I'm allowing myself to explore again. Where that exploration will lead me, I'm looking forward to it.
My name is Kristen Lindstrom. I'm a physical therapy supervisor at Kaiser. It made me more aware of the interactions and the communication that I have with my children will affect how they hold things later in life. A shift in my whole being and sense of being able to just, first of all, stay relaxed, not be in that, I feel like usually I'm in that sympathetic state all the time, and when I'm with them, to have a calmer way of communication and to just to let them know that I'm really listening to them, that I'm not trying to multitask and do a bunch of other things while they're trying to get my attention, but to really just give them some individual focus and give them my presence. My name is Magda Gorecka. I'm a physical therapist working with children in the Bay Area. And after our 3-day workshop with CFR, I feel like I can be close to being a child again. Having fun, feeling my body moving in all new areas that sometimes became forgotten, and feel happy, light. Well, I had a very nice change working with one of the lessons when we were able to differentiate our fingers and work with the shoulder mobility, which changed completely my shoulder girdle and how much freedom there was. And surprisingly, on top of that, there were some changes that actually happened within my upper jaw and my palate. I don't know, it just changed. I don't know, it just wants to smile. It just spread out and became bigger and softer, and I don't know, some things are just surprising. Our body takes it in and brings you all the goodies you need.
Hi, Hi, I'm Yoko. I'm a physical therapist working in Roseville. It's a very powerful way of finding or discovering yourself to go deeper to a place where the potentiality of profound healing can be found. And this work gave that tangible tools for us to get there. As a physical therapist, I use the physical body as an access or entryway to get in touch with the patient's body, mind, and soul. And in a way, it's limited if we just stay at the physical level. Just realizing that there's a certain aspect of physical condition that has emotional in nature, and this work created the bridge that that I can use to get to where I need to go in an efficient, profound way that I had sometimes wasn't able to do. This work is giving me a way to heal myself, because I really do believe that healing myself deeper helps my patients. I can only help those patients who are in need to the level that I have healed myself. I had this condition in the right low back with the sciatica, with a numbness on my foot. I have a feeling that I have an upper hand on this condition because I can see where it is coming from. So that by working on that, with this work more, that I can shift it and make the change. So that gives me a sense of hope and a sense of empowerment. If you feel that the technical manipulation of joints and tissue has only gone a certain amount but hasn't got to the level that you or the patient wanted, this might be another piece that you can utilize to get there. So I'm very grateful for this work.
I am. I'm a professor of nursing and nurse practitioner. I'm working on my doctorate degree, so I'm pretty busy. I really didn't think that I would be able to do the movements. And the first time they said to get on the floor, I wasn't sure that was going to happen. I couldn't imagine it, but I tried it, and I'm getting up and down for the past 3 days off the floor fairly easily. Oh gosh, I haven't sat on a floor for years. I haven't even tried, and I was always afraid if I was ever on the floor, I'd never be able to get back up. And we learned lessons where using good body mechanics, I guess, a good function of the skeletal system to be able to stand up and sit down and not get hurt. I don't know, the second lesson though, I was angry. I didn't want to give up the control that I've had over my body because I felt like having that control would prevent me from having more pain. And I was really scared, and I was afraid to let go of the control because I thought that I'd have more pain. But what ended up happening was, we've been here for 3 days, and the past 2 days I have woken up without pain. Since my hip surgery, I haven't been able to sleep through the night without pain or get up out of bed without pain. And now 2 days in a row. It's amazing. Anything is possible if you let go of old beliefs and that self-talk that we have that tells us we can't do things. The knowing that I'd have chronic pain for the rest of my life, and now there's possibilities that with some more work I could be pain-free. I really believe that's possible now. I didn't see that before. I have an appointment with my surgeon in a few weeks, and we were looking at doing a hip replacement. I'm not even going to talk to him about that now. I don't think it's necessary.
Hi, I'm Chris. I've been in law enforcement for 30 years, and I came to CFR with injuries pretty much all over my body: knees, hips, lower back, cervical, shoulders. I had surgery on my shoulder a year ago, and I'm pending 2-level artificial disc replacement surgery. And after 48 hours with CFR, I mean, it sounds like a miracle, but my pain is like 90% less than what it was, and I'm really second guessing myself regarding if I'm even going to have the surgery. And at this point, I think I probably won't, but I have more hope for my healing and my ability to be able to return to an active life than I've had for years. It really does feel like a miracle. I'm a student of the brain, so I'm not surprised that the brain can, heal our body. I just didn't know how to do that. And I feel like with CFR, I've been given the tools to let my brain heal my body. And I'm really, really excited about it. The beginning of the class, I couldn't even lay down on my back flat. I had to have my knees elevated. I was in a lot of lower back pain, even attempting to straighten my legs. I couldn't hold it at all. Now I'm very even and relaxed on the floor without pain. And I walked my dog last night, and where I felt some thoracic tightness by the end of the walk just from moving my body in a way that I learned in CFR, I felt that tension just release, and it was just kind of paying attention to it and giving my body permission to let go of it. It was amazing. And I mean, just the emotional piece of what the staff brought to me, not realizing what I was holding on to and was manifesting in my body, and figuring out what that was and to let go of that. I not only feel physically better, my spirit, my mind, my emotion, everything feels lighter. Like, I get that if I don't take care of my body, it's not going to be able to take care of me. I just feel so much hope for the next stage of my life, and how I can be active and strong and fit and happy. Highly recommend it.
My name is Sharon Valentine. I am a physical therapist, and I'm also a supervisor at California Pacific Medical Center in the outpatient clinic. And I have been looking at this class for a while. I was very interested. I wasn't real sure what it was about. At the age of 2, I had spinal meningitis, and so I had to relearn to walk. Back then, they didn't have pediatric physical therapy. So reading through the concepts, and it was very intriguing. So the first day when I came and got on the floor, I was a little surprised. Wasn't real sure what this was about, but I realized a couple of things very quickly: that it takes me so much effort to move, and it doesn't need to be so difficult. And it explains a lot of the pain issues I've had, a lot of the tension issues I've had. And so this has opened up a whole new world, not only for me, but also for the patients that I work with. So I'm very excited to explore this more and use it in the clinic. The thing that would change the most is the effort that it takes. These movements were so simple, not painful. It just makes sense. The scientific knowledge that they're putting to, that they're gathering now has really, it just makes sense. I would describe CFR as a whole new way to retrain the brain to move. It's another tool that we can use, but when everything else fails, this is something that really needs to be looked at, because it's probably the issue with the patient. I feel personally, I've always had a lot of tension and tightness. Emotionally, I feel revived. I had some emotional release. The pain in my shoulder is gone. At right SI joint, I've had 6 years of right SI joint issues, and that's better. So for me, it's been a success in dealing with my pain issues. Thank you, CFR.
My name is Scott Schaefer. I'm a physical therapist. I'm in the Santa Cruz area. I'm a clinic owner there. And I've taken this course and really learned a lot. I feel like there's a great deal I can do to creatively work with my patients and progress several who have not made any progress in other methods. Besides gaining tools to work with my patients, I feel like this has helped open up my own body and help me get more in touch with myself and my own movement patterns. I'm used to using a certain weight for an exercise, free weight, and after one day on the floor doing these movement exercises, I used that same weight and it was moving with probably 1/4 the effort. So for someone who has difficulty getting in and out of a car, it could make the difference of moving their own body weight through space in a more efficient pattern. I would say that for a patient who's fearful of activities and exercises that they've gotten in the past that have made them worse, this is a very safe way to progress someone so that they could get confidence that they'll move forward instead of backward. It actually helps people to get over their fears of movement, and that's a huge step forward. I saw people's posture spontaneously improve. I saw people with very depressed rib cage open up phenomenally, and not in a conscious way, in a more organic fashion. So there wasn't necessarily a sense of effort involved, and the person works on the activities, and then those activities work on their nervous system to help them to move in more efficient patterns. Well, just from a practical day-to-day point of view, it's a very enjoyable way to get your CEUs, and it's a way to refresh, I would say, your own or enliven and refresh your own practice. So it can give you not just new tools, but certain direction where you can be creative and use methods you're already using, but use this as an adjunct to kind of change the direction or change the angle of your treatments so that it fits the particular person better.
I'm Joan Marie Wood. I live in Oakland, California. I heard about the CFR training through my PT, and I was very curious. I've had a series of lower body injuries and sort of chronic, several chronic pain situations. Part of me felt like, how could this possibly really work? It's been an amazing experience for me. One of my goals was to be able to walk without pain, and I've been doing it. So I couldn't really walk for more than 10 minutes without feeling some kind of triggering in my PT tendon. My knee pain is a little different. It comes when I make certain moves with my leg, or if I hit it with my hand or against the table leg. So I think, actually, I'm just realizing right now, as I'm talking to you, that what's happened with that is I feel a lot less fear and vulnerability around this. I had such heightened feeling of fear around it, and that seems to have relaxed. When I drove here this morning, I got in the car and I turned my head. I could turn my head twice as far as I was able to. I feel absolutely no hesitation to recommend this work for anybody, I think. But speaking as someone who's 72 and wanting to stay active, and I feel like anybody who's experienced a sense of limitation later in life, just don't give in to that idea that aging is, where it's at, and you're just going to come apart or decrease in function. I think this work has a possibility to renew you from a very, very deep level. And it's also presented in a way that you can take what you need right then from it. Your experience is what matters most to the people that are leading this work. Well, I moved from feeling a little uncertain but curious, not willing to invest myself very much, to feeling very held in a safe place to be who I was right then, on a body level, especially and an emotional level. I feel like I have an understanding now and a way to work with that. I was so focused on fixing my knee, that I didn't have a sense of my whole body as being participating in that injury in some way. And now I feel hopeful and excited and curious to explore that. My whole body walks now, but I feel it in my entire torso and shoulders and head. I didn't want to stop walking. Before the day that we met, and I fell. I tripped on the sidewalk. I came in a stirred up state, and I almost didn't come to the workshop because I thought, can I do this? But my doctor was encouraging and said, you can do it. So that completely went out of my radar screen. After the first day, that sense of being kind of like shook up from that experience, I haven't even thought about it until right now. What replaced it was a sense of relaxation and presence, and in this sort of safe holding place. My whole system relaxed and let go. And then I was involved in what we were doing, and I was no longer thinking, I was just present in my body. So I think it's the invitation to be present.